Hello, everyone. Thank you for being here for today's webinar, What the Best Do Better to Improve Population Mental Health, Practical Ways to Harness Creativity, Build Partnerships, and Catalyze Impact. We're going to get started in just another minute. Let folks enter the waiting room. All right. Hi again, everyone. We're so excited to have you here with us today. Just right at the start of the call, I want to say that today's event is being recorded. The recording and the slide deck will be shared out by the end of the week. So you can look forward to that and relax and enjoy the conversation. My name is Colin Boylan. I am the Senior Public Health Engagement and Communication Specialist at NACCHO. Thank you again for being here for today's webinar, which is hosted in partnership with one of NACCHO's Diamond Partner affiliate business partners, Credible Mind. Credible Mind is committed to meeting community mental health needs head on with a powerful yet simple platform that's purpose-built for public health teams and friendly for public health budgets. Scalable, evidence-based, and customized for your community, Credible Mind delivers greater reach, early intervention, navigation to local programs, and data insights. Hundreds of communities rely on it to serve as a hub for community-wide coalitions and collaborations, and the Credible Mind platform powers NACCHO's Behavioral Health 360 program. So before we kick things off, I just have a few housekeeping notes. Again, the session is being recorded and the slide deck will be sent out at the end of the week. If you're joining us live, I invite you to participate in today's conversation. If you like, let us know where you're tuning in from today, maybe your state and city. And also, if you have any questions throughout the conversation today, we ask that you put them in the Q&A, and we'll do our best to address them as we go. So it's my pleasure now to introduce our discussion facilitator, Eric Zimmerman of Credible Mind. Eric is then going to introduce our panelists. Eric began his career at the Fielding School of Public Health at UCLA. He's worked with organizations and communities of all types and sizes to improve population health and well-being through the design and deployment of scalable, science-backed solutions. Eric has advised Credible Mind since its founding and joined its executive team full-time last year. Eric is going to introduce our panel, and let's get this started. Eric, over to you.
Hey, Colin, thanks. And thanks for everyone for choosing to spend a little bit of time with us today. I know time is very precious, especially this time of year. I'm really excited to be joined by three of the best. And I say that because this session is called What the Best Do Better. And we put that in quotes. But these are colleagues of yours who have done great work on behalf of their communities. And we find that what they do with Behavioral Health 360 and the Credible Mind platform is far more creative than anything we ever thought of. So we like to share those ideas, those best practices, those innovations, so that others might benefit when they think about meeting similar goals for their community. I'm really excited to be joined by Siobhan Allen, who's health data analyst for Sauk County Public Health in Wisconsin. She has great experience in grant writing and instructional design. She leads the efforts related to the Community Health Needs Assessment and Improvement Plan. And near and dear to my heart, she addresses social determinants of health and focuses on data-informed quality improvement. And we'll get to hear more about what that all means. Joining Siobhan is Peyton Brock, a self-described public health nerd, and I like to say I resemble that comment. Peyton serves as Performance Management Director and Epidemiologist at Oldham County Health Department in Kentucky, just south of where I grew up in Indiana. Peyton oversees data management, strategic planning, continuous quality improvement, accreditation, as well as other things. Welcome, Peyton. And last but not least, Jamie Gade. She serves as the Social Determinants of Health Coordinator for Johnson County Public Health in Iowa. Jamie is a health planner and analyst. She's got diverse experience in health engagement, coaching, even graphic design. I think when you do what we do, you have to be a five-tool player, and Jamie certainly is. And before we get started, since we have a lot to share and talk about, but we want to keep this interactive and in tune with your needs, hoping I can lean on my friend Janae at NACCHO to post a poll for the audience. And so this is your warm up to kind of get your hands on your keyboard and sharing a little bit about what's on your mind. What's on your mind today in terms of what you want to walk away with? Because we're going to be wide ranging, but we also want to be focused on you. Is it about where do we begin when we think about community-based mental health initiatives? How do you get this whole thing started? Is it about getting the word out, tips and techniques for promoting and growing engagement across the community? Are you more interested in the strategic partnering and the coalition building and bringing organizations together across the community? Maybe it's about measurement. How do we show value? What do we do? What do we measure? How do we make it happen? And sustainability is really important. How do we keep it going? Especially since programs sometimes start out as grant funded. So what are some of the techniques for really keeping things growing and going financially and otherwise? Well, go ahead and answer that question. You can pick more than one, and then we'll take a look and see what's on your minds, and we'll gear our comments accordingly. It's been up for a minute. Maybe, Janae, if we're getting some results, let's see what people are saying. Well, I'm sensing a little bit of all of the above here. There's not one that's standing out. Maybe partnering is a little bit higher than the others, but that's a pretty balanced view at what people need. So we're going to try to touch on each of those topics over the course of the next half an hour or so. We will leave time for questions. We do encourage you to use the Q&A in Zoom and go ahead and pipe in, and we'll stop from time to time to take some of those questions. So go ahead and feel free to join the discussion at any point, and we'll involve you in that way. I'm going to begin with a sort of a you are here, because not everybody knows what is this behavioral health 360 thing, and what is this population behavioral health thing? That's a phrase that maybe you haven't heard of before. If you think of population health, it's thinking holistically about the needs of the community. Behavioral health is this term that came to be to talk about the combination of mental health and substance use disorders collectively. What does that look like when we do that through a public health lens? Well, the why is a kind of a by the numbers page that we like to talk about. And all of this is important, but I want to kind of land this particular plane on the bottom line of the slide here. There's a lot of need out there in the community, and people don't know quite where to turn. They tend to want to start on their own and not necessarily by leaning into clinical care, though we certainly need to make clinical care available. And Credible Mind began with that intention in mind. We want to help people with evidence-based approaches that work, because let's face it, we don't think we're going to ever be able to treat our way out of the problem of mental health in this country. It's estimated we're about 250,000 clinicians short of the demand, and that's growing every day. And a lot of public health goes on in underserved communities. If you think about this idea of a mental health desert, you might have heard of a food desert from a nutrition perspective. Well, we now talk about mental health deserts because 2/3 of the counties in the US don't have enough practitioners. What's more, it takes a long time for a person to decide to seek care. Can we intervene early, just as we've done in other areas of health, whether it's cardiovascular, chronic conditions? What can we be doing to help mitigate need, reduce the overcrowded EDs in our communities? That's what we're really all about when we say population behavioral health. That's sort of the why behind it. There is a science here. This happens to be a journal article written by a couple of my colleagues here at Credible Mind, and it basically says, from a public health perspective, we need to improve access. We ought to be using validated screenings as a basis for understanding need, evidence-based self-care, as I mentioned. And when we do help people seek clinical care, perhaps it can be screening informed in the same way that we've done that around cardiovascular diseases with blood pressure, cholesterol, et cetera. What's the equivalent from a mental health perspective? So those are the types of things that we've been working on and working to make available. Technology is a scaling factor, and I'm not going to go deep other than to say there's a lot of like, oh, AI, what does it mean? What does it mean? there's a lot of good we can be doing to guide intervention pathways and discover insights. So there's some ways we can use technology, even though we know at the end of the day, this is a people profession. We want to scale ourselves and scale our programs using technology. And that's a big part of what Behavioral Health 360, this NACCHO initiative, makes available out to communities through the partnership with Credible Mind. And we're making strides. We've been at it for a couple of years now. And you can see the map here. We'd like to turn some of those light blue states green, meaning we have presence in communities in that state. It's been growing steadily, and we're just so grateful to the partnership with NACCHO around Behavioral Health 360 and excited to see where we go next. Today, you're going to hear some of our leaders who are doing the work on the ground to share their stories. I'll end with data because that last question was like, how do we keep it going? How do we collect the right kinds of data to show we're making a difference? This is just a kind of a highlight reel of what we're achieving together with NACCHO. First and foremost, people are engaging in meaningful ways. We're helping them to understand what's available, and we are serving as a triage point. We all know that the clinical resources in our community are overtaxed. When this sort of a tool set's in place, it turns out that people do self-direct in a good way. If they're at lower risk, they'll lean into a self-care resource. If they're at higher risk, we're able to connect them to a clinical, a community resource, a care resource in a really effective way and make best use of those precious resources. So that was a really quick digest for those who are new to this topic. What I want to do is turn attention to, well, what does it actually look like on the ground now? And in order to do that, I'm going to invite perspectives from my colleagues. Um, Before I do that, any questions coming in yet, Colin? If not,
Not seeing
I'll
any
ask
yet.
again. Cool. So again, there are three experts here with us. Um, I'm going to start with you, Siobhan. Would you just tell us a little bit about your organization and how this came to be, how you got connected to this initiative? Um, Thinking about that very first question, we asked our audience, like, what do you need to know? And some of the folks said, like, how do you get going? Maybe start with your experience in Sauk County, but how did this get started? And maybe a little bit of advice on how or a county that's thinking about this might move forward.
Yeah, thank you, Eric. So I'm from Sauk County, Wisconsin, and initially this process for us started with our 2021 CHA, and our community health assessment identified mental health as a priority area for us to work on. And so we convened a mental health action team and collected some data, as you do with a CHA and a CHIP process. And the data really showed that, like Eric shared, that people need care. There's mental health deserts where you cannot access clinicians. There's not enough of them. And also the wait times were really, really long. And so initially, our team wanted to create a while you wait packet that had resources and different things for people while they waited on these really long wait lists to see a clinician. And in trying to figure out, okay, how are we going to make these? We came upon through a NACCHO webinar, Credible Mind, and we're like, this is exactly what we need. And so our mental health action team convened together and we're like, okay, how can we purchase this? How can we buy this? And we had some of our local hospital partners, you can see their logos on the screen there, that kicked in some funding for us to be able to purchase the Credible Mind platform, and we launched it in May of 2023. So looking at some of those partnerships and through that CHA process, working with our hospital partners to be able to bring this to our community.
Beautiful. That's a pretty common story, and I think it speaks to the power of the coalition and recognizing that agencies in your area, hospitals, health delivery systems can be integral parts of this, not just in creating a feeder system, but also in co-funding the efforts. Curious to know whether others have similar sort of founding stories. Can I turn to you next? Uh, well, actually, I'm going to skip to. I'm going to turn to Peyton for a second and have her tell her origin story of this, and then we'll come back and share some examples. But Peyton, tell us a little bit about how it began for you.
Yeah, absolutely. So, hello everyone. My name is Peyton. I work in LaGrange, Kentucky, which is a small bedroom community of Louisville, Kentucky. And like so many places, we face barriers to mental health access, whether it's providers, wait times, etc. These issues aren't unique by any means, but it made it clear to us that we needed to explore non-traditional, lower barrier options to support mental health and well-being, especially tools that people could access anytime on their own terms. We are grateful to be a smaller, closer knit community, and we've had great buy in from not only my health department director, but our leadership in the community. On our webpage, for example, you can see that we are funded by opioid abatement settlement dollars because us in public health, we know that mental health acts as an upstream factor for opioid misuse. And so we were able to ask our fiscal court to pay for this. And they said, oh, yeah. So the one thing that we do each month that we change our topics, we include opioid use or addiction or recovery or a similar topic each time to make sure we stay in compliance with any deliverables needed by the opioid abatement committee. But we've been super grateful to have this community buy-in, and it's all because of the relationships that we have.
That's terrific. And Shavana mentioned they found out about it at an NACCHO event at a conference. Was there a way that your organization learned of this as you began looking at the community health needs? What was the way you found your way to it?
Yeah, so I believe someone from NACCHO actually contacted my director first and was like, hey, do you want to see a demo of this? And he said, oh, yeah. So we immediately had a call with I believe Tara from Credible Mind, and she's been fantastic to us ever since. But she showed us the platform and what it's done for so many communities because we also, again, it's not a unique problem. Mental health concerns have consistently come up on our CHA chip, our community forums, and we were really excited to see what this platform could do for us. So we're still relatively new to the site. We launched on Valentine's Day of this year. So last week we just celebrated our 9 months of launch. So
That's beautiful. That is great. Let's hear a little bit from Jamie. How does your story compare in terms of how you found your way to this approach? What the community data said? Just curious to hear how Johnson County chose to approach community-wide mental health in this way.
Yeah, Johnson County was very similar. So I'll give a little bit of a background. In Johnson County, Iowa, which we're in Iowa City, Iowa, we've got about 150, a little more than 150,000 folks that live in our county. But we had really the same issues too. Mental health was also a priority of our CHA process, and it had been really for the last 10 years of what I'm aware. Same thing too, provider shortages, really long wait lists, just really a lot of barriers to receiving care. And so we did get connected with NACCHO. We had heard, especially when NACCHO offered some cost discounts, I suppose, on the subscription. We applied for that and then had received that. And so we really took that to our Board of Health, and our Board of Health had approved 2 years then of funding, mostly using tax levy then at the time to get started for really owning this product in our community. We call it our Healthy Joko Credible Mind site, and Healthy Joko is just our CHA chip process. So yeah, I think we launched in November, or let's say October of 2024. So we've been a little over a year, and so we've seen really a lot of use, and a large chunk of the population, 13 to 44, we see that age range being really using Credible Mind for this last year. It's been really great.
Am I back?
Eric,
Okay,
you're
good. Can you hear
back.
me?
We're not seeing
Okay.
the slides though.
Okay, let me reshare. We kind of made a joke about maybe the internet would go out, and maybe I jinxed it. So hang on, I'll bring the slides back up. How's
you go.
that?
Looks good.
All right. Sorry about that, Jamie. Didn't mean to interrupt your flow. You were sharing the origin story.
No, all good.
Cool. I'm curious to know whether any of you, clearly there was a path to identify the need and to identify a solution set, Behavioral Health 360. Were there people you needed to convince along the way? Obviously bringing funding from local hospitals, but talk a little bit about the process of getting buy-in. Anybody have a story to share about that? Were everybody's bosses completely on board, or maybe it was their idea? Just curious to hear how that goes inside the organization for those who might have motivation to do this, but they may be thinking, how do I convince folks?
I will say, so we do have great buy-in truly, but something that made this program in particular feasible for us is that Oldham County has prioritized this digital infrastructure. We were actually the first in Kentucky to partner with the Commonwealth of Kentucky to expand high-speed broadband internet access with the goal of reaching every home in the county. And we accomplished this in May of 2024. So having this digital equity really laid the groundwork and helped us convince like we have this as a resource. So why not meet the people where they are? These digital tools expand access and give everyone agency in managing their own mental health.
That's a really good transition to the second topic we want to get to is once you have the approval and once you have this launched, how do we get the word out? And I'll stick with you, Peyton, since you were sharing those stories, and I may even show some of your pictures, but I'd love to know what's worked. I think a lot of our audience may be thinking, well, this is great, but it's not an if you build it, they will come. How do I connect this to the needs and the people who could benefit the most? Any
Yeah,
stories you have to share about that?
always. So I mentioned that we are a bedroom community of Louisville. Many young families and people with children come to Oldham County because of our robust school system. So we do have a high percentage of children as a part of our population. And correlating with that, our highest percentage of users with reported demographics, that is, makes up the 13 youth age group. So over half of our users with reported age demographics are kids. And so we take this and try to cater to that younger audience as much as we can. One of our main partners is our library system. We have 3 branches in our county, and something that we wanted to do and we've seen done before is make bookmarks. So if you'll go to the next slide. Yeah, so we made a double-sided bookmark. The main language spoken in our county is English, followed by Spanish. And so our dual-sided bookmark has both English and Spanish written on there, directing people to the use of the site, and of course the QR code. And then if they scan the Spanish side, it will take them to the Spanish website and the English also. So we wanted to make sure that these got their way into the community and into the children. So we had these bookmarks initially at summer reading program launches, at book fairs. Anytime we have our way in the school, we bring these along with us. We also have a huge presence with mental health first aid classes. So on the right, you'll see one of our partners. She is teaching a mental health first aid class, and she is showcasing one of our bookmarks. And so we are empowering our community by giving them not only mental health first aid, but literally bringing them the bookmarks so they can take them with them and share them with other people. So it's been a great experience for us so far.
I just love that. It's a great example. We at Credible Mind would have never thought of bookmarks. Like we know the need is high among youth, and by the way, the platform is available for 13 and up. Below that, you start getting into you need a parent. But for teens, it's a big deal. And this is just so creative and so low cost. You see the use of QR codes there. You'll notice these throughout the slide deck as well. If you see a QR code, feel free to point your phone at it because each of the sites that are launched now as part of Behavioral Health 360 for the communities represented by our panelists, you can get there for free. It's available open to the community. So those, if you were to click the scan me, you would actually go there today. That's fantastic. I'm curious to know whether others among our panelists have also done things with schools or done anything similar to try to get the word out. Jamie, you look like you have something you want to say.
Yes, the bookmark idea is awesome, and I love that, and I'm writing that down to steal that. We've done pamphlets, I think that have been really helpful and honestly really similar. I think we have pamphlets all the time at tabling events, and so we do so many tabling events throughout the year just as the health department. So we'll have Credible Mind brochures there always. So we've done our local like NAMI walk. We've tabled at an Iowa Mental Health Summit just this past year, which was really Iowa-wide, but we did connect with folks in our community. So talked to judges even and law enforcement folks too about the use of Credible Mind. We were at a recent pediatric conference too, so we talked with providers there. We knew we wanted to talk to a lot of providers too, so that they could talk to their patients potentially about this, since the wait list is really long to get folks into see care. So we even talked with a hospitalist that works in the NICU, and she said, you know what, this would be great to give parents. They're not our patient, but the baby is, and we want to support the parents too. So we've connected with them that way. But our brochures are also in English and Spanish. We have the English and Spanish capabilities on our website. So we made sure we wanted to get all the materials out too in those two languages. But yeah, I think a lot of it's just relationship building too, and reaching out specifically to community leaders, providers, like I mentioned too, and then other folks who maybe would really use this. Libraries too. We've had pamphlets out at libraries as well, and have special QR codes to kind of measure who at the library is scanning that and where, really where they're coming from, so we can kind of understand what a good outreach method looks like. But the site really makes the measuring on that end with outreach and the success of the outreach really easy. So we've appreciated all of those analytics.
That's beautiful. And I love that you've used codes to sort of create some traceability of where is traffic coming from, because it really helps to understand that. You can actually do that with codes. I love that. Siobhan, anything you'd like to add in terms of ways of getting the word out?
Absolutely. Like Peyton mentioned the bookmarks, we've also done bookmarks. That's been a really popular for us to hand out at events. If you go to our slide, we also did these little table tents that you can see the image on the left-hand side. And that's actually at one of our middle school's libraries. So we were able to get some of our material into our local school districts. And so that's available in English and in Spanish with the QR code that the kids can scan to look at materials. And we also do see that the greatest number age group of users on our site is that 13 to 17 age group. So we are reaching a lot of youth that are wanting access to mental health resources and materials as well. Another
That's
thing that,
beautiful.
oh, yeah.
Go ahead. Yeah,
Another thing
keep
that
going.
we just tried, our communication specialist actually had this great idea. We distribute gun locks, and you can see in that other picture, they're kind of in that left corner there. And our communication specialist is like, well, why don't we also distribute our Credible Mind materials when we're distributing the gun locks? So it's hunting season in Wisconsin, and at some of our local meat processing plants where we distribute gun locks, we've also distributed the little table tents and Credible Mind materials, because as long as you're picking up that, you then also have those same materials. So that's something new that we're trying. So we'll see how that works, but we're pretty excited about that one as well.
That may be a first I've heard of pairing it with gun locks. That is so clever. I think you go to what the audience is thinking about and you try to pair it as best you can. So that's really, really creative. I'll pile in a couple others that I've heard some of your peers share with us. We have worked with 988 lines. In fact, we've done programs for the agents that are on the phone on the 988 lines, because if you think about what their day is all about, it can be very traumatic. And so giving them the resources to keep themselves mentally well can be really important. We've also, you'd mentioned law enforcement, libraries, schools. Curious to know, has anybody partnered with private sector companies or other organizations? Again, just in the interest of partnering, building coalition, getting the word out, or reaching pockets of your community that might be otherwise harder to get to. Anyone have a story about that?
I will add, Eric, if you go back to my second slide, twice a year, our community will do a countywide issue of the newspaper for free. And so it goes to every household. And so this one just came out in early October, I believe. And on the left, you see it. We put a whole page ad of Credible Mind and our QR code to our website in there. And then we've also recently, we did it for the first time this summer, but we called it Be Kind to Your Mind. And it was a combined youth and parent mental health promotion event. And so then the picture on the right is someone speaking at the event about Credible Mind in our bookmarks. So we are getting out there and we're trying to, like you said, reach every corner of the county.
I love seeing this in the newspaper. I think that's pretty special. I have more stories to share in a sec, but let me pause because I realize it's been a minute. Colin, is anything coming in from a Q&A or a chat perspective that you think is we ought to address at this stage?
Well, there's a few. Thanks to everyone for who's posed a question. I'm gonna just flag a couple. These might be things that we've touched on a little bit already, but someone has asked about, most recently asked about literacy/reading levels for use of Credible Mind. I'm not sure if that's something we want to touch on now or later.
We sure can. Do any of our panelists want to talk about how they think about? I can certainly share that we write to a level that's, sixth grade. It's sometimes it can be tricky with information that has a medical angle to it, but we really think about reading level as we construct content, as we bring in content. How do you guys think about that? Anybody have a policy they follow or some guidance that they might share?
When we're advertising our programs and services and creating our outreach materials, that reading level is something that we're always mindful of. We have a communication specialist on staff that does a really great job when she creates and shares not just Credible Mind materials, but other materials as well, to try to keep it simple, keep the bottom line up front, and making sure that things are easy to understand. So that's something that we try to do. And for the most part, what I've seen on the Credible Mind website is that it is pretty plain language and easy to understand.
One thing we attempt to do to address that as well, Colin, is provide multiple ways of getting information. Some people are much more visual. Some people want to watch a short video. So we do have a variety of ways that people can absorb content, whether it's psychoeducation content or more interventional, what can I do type content. You will find an array of resources, blogs, videos, audios, as well as traditional articles and things you can try on your own. We call them practices. So this is always a concern. We aim for fifth or sixth grade, and we do try to keep it pretty diverse. Over to the language topic, our experts have mentioned English and Spanish being something they've deployed. We've built the platform in such a way that we can support up to 38 different languages. So that's a piece that might be important in your particular part of the world. You might have a lot of speakers of a particular language. It's something we can definitely support. But yeah, literacy level is a thing. What else, Colin? Any others that are worth touching on?
Yeah, that was a great response. Thank you. In a bit of a similar vein, it's someone has asked about internet connectivity and bandwidth issues, and if you could elaborate on using the platform in maybe a rural locality like that.
Always an issue with digital solutions. This is built as web. It doesn't actually require you to download a mobile app, but by the same token, when you download a mobile app, sometimes there's native functionality on your phone. This does require a web connection. And so, it's built to be pretty light touch, but that is a constraint as we start getting into localities where, look, I'm near an urban center and I had internet problems this morning. So none of us are immune. Um, but we certainly do depend on that connectivity for this to play.
Great. So I'll give you one more question and then we can save some of these towards the end.
Sure.
For those in larger/metro areas and counties with varied competing needs and also very high health disparities, do you have recommendations for how to get enough leadership and funding buy-in?
Love that question. And I know
Big
you all
question.
work in order. Each of our panelists has a variety of populations that they might serve: towns, cities, rural. Have any of you experienced this where you might have a lot of density and it's a more complex chessboard in terms of the partnering and the competing for attention and resources? Any words of advice to share?
I could chime in with this one. I think our county is similar too. I mean, we have a pretty highly populated metro area, and then we have a rural area too that is kind of along the borders of our county. And I think we view this tool as just that, like, one of the tools in our tool belt. But we know that there are other tools too that might work for other populations too. But that we've seen about a little over 4,000 users. And so, we know that it's reaching folks then who need to be reached. And, are we reaching everybody? No, we're really not. But we have other tools and other partners too to work with to really tailor those needs too. But I think that this really meets a really great need too, for folks who are able to log on and to really look at the resources themselves. As far as getting some support too, I think we're pretty lucky in our county too to have really great boards of health, and our boards of supervisors are really supportive of public health. And so with any new potential requests for actions on funding opportunities, I think they kind of understand, what we're going for and what we're looking for. So it was great to have a supportive board of health to approve to fund this. Looking forward, I think we've got a lot of other opportunities now, especially that we have data of who's using it. And so I think that it'll help a lot with approaching funding conversations with partners who are using the platform, and potentially a cost sharing model could work out really well too for sustainability. So that's something that we've been looking at for the future, and for even in the next fiscal year, for keeping this tool here, because we've seen a lot of really great use. And even if at county level, we were looking at cost per user per population of our county, and it's about 11 cents a user. So when you look at it that way, it's pretty
That
low cost.
that's astounding. Just what you can get for 11 cents. I mean, there's not much in the world you can get for 11 cents anymore, Jamie. That's wonderful. So I'm going to put a pin in that because we're going to come back in a minute to measurement and sustainability and get deeper on both of those topics. But I appreciate you sharing a little bit. Siobhan and Peyton, anything you'd add in terms of when you're dealing with a more urban population or the complexity of the organizational dynamics? I have some stories to share as well from others, but I don't want to, cut short the opportunity to hear from you.
I will say, I feel like our county and our community kind of helps bridge that gap a little bit. If you're not familiar with Kentucky, Louisville is our biggest city in the state. And we do not restrict users on our website. So obviously, we kind of cater towards more Oldham County specific advertising and outreach, but we do not limit your use to your zip code. So anybody from the Louisville community can still see our advertisements and can still log on for these resources, because we all know community is not just where you live, it's where you live, work, play, interact, all of these things. And especially in urban areas, we used opioid abatement funding, and that can be an issue there. And mental health truly does act as an upstream factor for misuse, because underlying mental health issues, trauma, and these other unaddressed psychological needs. So I do believe that smaller communities like ours are still able to help larger communities by not restricting our resources.
That's great. I will say this is a team sport. I don't know how else to say it, but we've observed now that we're out there in over 200 communities, I can think of very few instances where these initiatives aren't in some way, shape, or form driven through a coalition of partners. And in urban settings, it's a more complicated game, right? But local hospitals, community hospitals, even academic medical centers often play a role. Um, we're really proud to have a unique relationship with the American Hospital Association to make sure we're angling from both sides, the public health community, the care delivery community, because in many ways, what we've created here through Behavioral Health 360 and with Credible Mind is sort of a hub or a center point for the activity, because there may already be a coalition that's focused on mental or behavioral health, but oftentimes there isn't a single place to go. And you'll see, you see the screenshot here of Jamie's site for Johnson County. I love Healthy Joko, by the way. That's a really cool name. But you can see very quickly it leans into community resources and it recognizes the participating agencies and organizations that are part of this. So that's really the way the game is played. NACCHO has a lot of terrific resources around coalition building. We do as well. I'll share a little bit of that toward the end. But I think it's co-opting and finding areas of shared interest. Where do our interests align? We're not trying to compete. We're trying to just take down barriers and make it more possible for people to get to what they want and do it on an incredibly, cost efficient basis to the point that Jamie made about 11 cents per person reached. Good. Any other questions for now, or should we hold a few for the end and
I
cover
think
some of
let's
the other
hold a few
topics?
till the end, if that's okay.
Okay. Jamie spoke a little bit about measurement and the fact that having a platform like this does give a key advantage of the if you will, the footprints are there. We can look at data. I'd be really curious to hear about what you're measuring and how you think about what success looks like and how you begin to translate that into a business case or a way to build sustained support. Noting that, and I'll tell you, I'll demystify it. Most of the organizations, counties that fund this initiative, the largest source is just the administrative budget of the county. This is not a high-priced item, and so it's an admin budget. But right behind that are grant sources. It could be a state grant. It could be the opioid grants that were mentioned earlier. So oftentimes it is a granting source, and sometimes it is a partnership with a local community hospital that has some funding, and they have shared interest in this topic. So they bring together funds to make it possible to do this. Um, with that said, measurement is key and it is tied to sustainability. And I'd love to hear how each of you think about measurement, what you tend to look at, like we provide dashboards, but what's the thing on the dashboard of highest interest to you? Um, Peyton, I see you shaking your head. You want to kind of kick us off on the measurement topic? Like, what do you like to look at? What do you think really connotes value?
Yeah, for sure. One of the hardest things I feel like in public health is prevention is often invisible. If we're doing our job right, we don't always see the outcome of that, right? So in the same way that you can't necessarily always predict how many cases of disease that vaccines prevent. You can't necessarily predict how many lives this platform saved. We're optimistic to kind of compare our community health assessment results of health indicators from before and after the program launch. So that will be coming in like 2 years. So stay tuned for that. But the biggest things that we love to look at are our number of users. So we're a population of 70,000, a little bit less than, and we actually just topped 14,000 users, which is like crazy to us that we're a small community and we're reaching this many people. Something we hope to improve more of for the numbers is the number of those people who make accounts. So while we have about 14,000 users, we only have 130-ish people with accounts that are logging in regularly to track their progress and truly take advantage of owning their mental health. And so we're looking at that ratio. And we're also looking at this feature called Need Help Now, and kind of using that. You can see in Jamie's screenshot right there, that red button right there. If you click on that, it takes you to crisis resources. And so by us keeping track of that, we are kind of getting a good pulse on how many people in our community are in need immediately and are considering, hopefully making a healthy choice instead of a negative choice.
I heard a few things there, Peyton. I just want to reflect it back and then, of course, hear from others. But the total reach is really important, and that's stunning that you guys are up to 14,000 out of a county of 70,000. It's phenomenal. I've not, we look at this from a benchmark perspective, and in terms of what the best do better, which is the theme today, we look at the quartiles of performance, and we know that there are certain practices that if you do them consistently, you might get 10, 12% of your population engaged. You're getting potentially close to 20%, which is pretty amazing. Um, that's meaningful in terms of reach. I also heard you say that they need help now, because that really is the lifeline for people to get to 988 and other resources. So that's pretty important to kind of track. It means we really are catching people. And then the third thing I heard you talk about is wanting to get registered users. In case that's not obvious to our audience, this can be offered anonymously, meaning people can come in without creating an account. What in life can you get for free without creating an account and not disclosing in a trackable way? This is one of those things. But to Peyton's point, if a person does choose, and it's optional, to create an account and track their progress, you can get so much more value out of this set of resources. It's just a matter of earning the trust and conveying the benefit for them to do that. So I think that is a great third metric to keep an eye on. And so those are wonderful. Siobhan, anything you'd add in terms of stuff you like to track and the way you see value?
Absolutely. So I'm a data analyst and I'm totally a nerd about all of the great reporting options that Credible Mind provides. And so I do track the users and the sessions like Peyton tracks. And I also like looking at specifically what are the topics that people are looking at, what kind of resources are they accessing. So kind of to answer the question of like, what does the platform actually do? It has a ton of informational resources. So it has articles, it's got videos, it has links to podcasts, it has links to apps that people can download if they would like. Some of those are free apps, some of them are paid apps. It tells you what it is for those resources. But I can look and see at our reporting, what are some of the topics that our Sauk County users are looking at most often. So I can see, well, we seem to be this month having a lot of people looking at resources about depression. Well, then I can select and we can actually make those topics end up more toward the top of our page so that people can find it faster. Or if there's community events or things coming up, I can see, well, how many people are actually looking at our community resources and the links that we're providing. So it's allowing us to be able to provide, here are the topics that people are looking at, but also to our funders and things like that, we can say, hey, here's how many more people looked at these resources. So we did use this data capability. About a year ago, we had a maternal child health grant with a focus on postpartum depression. And so we actually used the grant money to pay for Google ads. So anybody in Sauk County that was searching for postpartum depression, our Google ads put our Credible Minds site higher up on the list. And thanks to Credible Minds reporting, we were able to show the funder, here's how many people visited the site because of those ads. So it showed a really clear return on investment for those grant funded dollars. So the numbers, you can then tie it back and show the funders, here's how it actually works.
Boy, are we lucky to have a health data analyst on the panel with us, because that's fantastic. I think you're right. Being able to justify rather than just we think it's a good idea, but here's some actual data is really more than now than ever, right? With budgets, it's important to be able to substantiate the value we're all delivering. I'm curious to hear, Jamie, whether you have any examples of things you've looked at in the reports or maybe stories about how you've been able to translate to value, particularly to those who fund the initiative or who you feel accountable to.
Yeah, I echo a lot of what everyone else said too, just overall users. like I said, mentioned before too, we were kind of looking at based on our population and what we pay too, what would that look like per person in the county or per user? So what's that cost look like? And so seeing such a small cost, it's obviously very small, but also could lead to really immense health benefits for folks who are accessing the resource. We've tried to collect too, just like really casually stories of usage too from folks that we know we've talked to about the site, and so we've gotten some really awesome stories, and one about a user whose son was trying to work through a conflict of his friend, and she said, "Hey, you should check out Credible Mind for some resources." So his friend, he used an article on Credible Mind to talk to his friend about thoughts of suicide. So I mean, just that story alone, we were like, this pays for itself. This is just really amazing, an amazing tool to have in our community.
Never underestimate storytelling. As much as I'm kind of a data geek as well, like Siobhan, it's the human stories sometimes that really bring it together to complement the data story. So thank you, Jamie, for sharing that. That's profound that someone's kid shared this with their friend and, you know, could have prevented a suicide perhaps. It's just really, really important work. Wow. Wow. Let's start turning toward what's next, and then we'll leave a few minutes for some more Q&A at the end, so before we get to the top of the hour. But I'm just always interested in, we're kind of heading to the end of the calendar year, and it's a time of year we often reflect and take stock of what's been working, what do we want to do differently. As you look ahead at 2026, I would love to hear what's on your mind in terms of where do you see this going? What do you want to be trying or doing? Are there certain populations that you feel like we're not quite getting there and we want to try some different things? Just tell us a little bit about what's next for you from an audience or from a kind of take it to the next level perspective. And I'll stick with you, Jamie, since you were just chatting. What do you see as you head toward 2026?
Yeah, we are gearing up to meet with our student health. We have a local university in our backyard in our county, so we're meeting with their student health medical director, and so hopefully we could really get this in the hands of college students. We've seen more need for college students to access mental health support, and then we're actually working with a medical student right now to create dot phrases in Epic, so that when patients who are seeking care with our local hospital will, if they need some mental health resources, they'll enter a dot phrase called Credible Mind, and then it'll print out in their after visit summary. So those are really like the biggest things I think that we're working on, and then potentially looking at opioid settlement funds as well.
I'm learning all kinds of things from you today. Dot phrases and Epic. That's fantastic. I wrote that down. Um, and by the way, for those who do work with hospitals, we're now implemented as an integrated component of Epic and MyChart. For those who know what that is, it's a patient portal. We work with Intermountain Health as a large health system across the Mountain States. They have begun integrating it so that from a patient care perspective, they can do things similar to what Jamie just outlined. Because let's face it, we got to keep taking down the friction and the barriers to getting good quality mental health resources for everybody. That's wonderful. I love the college student story. We all know how vulnerable, that is. That's such a transitional phase for kids. And so, being there is fantastic. We'll look forward to hearing perhaps at the next NACCHO how that's going. So thank you for sharing that, Jamie. Who else? I'm going to just kind of go in order of my screen here. Peyton, what's on your mind for 2026? Where do you see things going?
We're honestly just excited to be getting closer and closer to our 1 year of implementation. As an epidemiologist by trade, I think about seasonality of things. And so different seasons come, different diseases, different concerns. And something that is near and dear to my heart, of course, is like seasonal affective disorder. And just prioritizing your mental health for the fact that you don't have to be in crisis to care for your mental health. We deserve tools and support for all stages of our life before things get to a breaking point. So I'm really excited to see how the new year and the holidays and how seasonal affective disorder might affect our trends and how we can better empower our community to prepare for these things.
I love it. And seasonality is often great for promotion perspective as well, because we as humans, we think about the seasons that way. We kind of, it's a bit of a restart. We're heading this is we're heading toward winter. We're, getting out the warm clothes. So those are great times to think about a mental health tune-up for that part of the year. And then similarly in the spring, we're kind of re-emerging. That's a great time to form new habits. So yeah, seasons are great. Siobhan, how about you? What's up ahead as you think about 2026 and taking things to the next level?
Yeah, that's a great question. Right now, just have to give a little plug because it's coming up on the holiday time, and we're currently promoting the Are the Holidays Causing You Stress assessment that Credible Mind provides. That's a great assessment. It's a popular one that's takes only 2 minutes to complete, so people can kind of get like a little check-in and how are the holidays affecting your mental health. And then looking forward to next year, one thing that I love about Credible Mind, and we've had this platform since May of 2020, and Credible Mind continues to add new features and new resources. And this year they added the Learning Lab. And that's something that I would like to see people utilize more because that Learning Lab has the series, which are different topics that people can learn more about. There's new courses now, and these are all free that are included as part of the platform. So it's not something that somebody has to pay money out of pocket for. So being able to promote and see people utilize more of those learning lab features that Credible Mind keeps adding up. So that's what I would love to see moving forward.
I agree. When the practices are the practices is just something you can do. It's not read about it, learn about it. It's what can I do right now to deal with my body signals. We use those, by the way, at Credible Mind with our own team meetings. Ashley, who leads our monthly get-togethers, we will start with a practice that we all learn together and give ourselves the tools for mental health self-care. So thank you for that. Colin, do we have another question or two from the audience that we might take before we wrap?
We do. I'm going to do my best to summarize a couple questions for you. I wonder, Eric, if you could talk just generally about the functionality of the platform. There are a couple questions about things like, are the articles and videos available in the platform pre-populated? And then folks also want to know about cost.
Sure. The most important thing about the functionality is it's simple to deploy. There are over 20,000 resources that are accessible, but that doesn't help a person in need, right? 20,000 is overwhelming. So we work really hard to bring just those things to the individual that could be most helpful. You heard examples of topics, seasonal affective disorder. So the most important thing is it starts with what's true for you. You could take a self-assessment. We have dozens of those. Here's what's available in your local community because you may be the kind of person that wants to go to a local resource, or here's something you might try on your own, whether it's to read an article, watch a video, or try a new practice. All of that is done in a very simple way where you can filter. Perhaps I'm having issues with a teenager and I want to understand, is that kid feeling true depression or is it just moodiness? Those are the kind of things you can do. All the functionality comes to the person, it's hyper personalized, and it's all free. As for the cost to the sponsoring organization, the quote of the day was 11 cents, right, per person. In other words, it's a really low cost thing. It's an administrative cost. It's something you might budget for administratively or with a grant. And we can get into it because it is based on the size of the population you're serving. But it typically isn't a break the bank kind of cost. And we can work with you creatively to create, here's how others have gotten this funded. Usually the funding isn't the biggest barrier. Oftentimes it's just the inertia to put something new in place. But we work hard with NACCHO to make it very, very affordable for counties of all sizes. I want to make sure that people know where to go next. We have a toolkit that we can make available, whether you're a Credible Mind customer or not, about how to build a sustainable partnership in your community. That's available. All of these QR codes on these slides are actionable. Or if you just want to shoot us a note, we can send you this toolkit. Can we just quickly run the last poll? We'd love to hear for those who are remaining on the call. What's the next step that makes the most sense to you? Because it'll help us help you. And you can see the choices here. Connect with peers, learn more about Behavioral Health 360, get help with coalition building, build the business case. If you wouldn't mind just quickly answering this last question, it'll give us some insight into how we can be most helpful for our community here. And Janae, any answers coming up that we might share for this wrap-up question?
Yes, they are. So I will.
Beautiful. Okay, so there you have it. We have folks who want to learn more about Behavioral 360, a little bit more about building the business case. So all of that is available to you. We're so grateful that you spent the better part of an hour with us today. If there are questions we didn't get to, Colin and I will work together to make sure we can follow up with you. But I just want to, thank everybody for spending the time with us. And especially I want to thank Jamie and Peyton and Siobhan for sharing their expertise today. You guys are great.
And I just want to jump in to thank Credible Mind, our Diamond Affiliate business partner, for sponsoring this session. Remember that the recording is being shared and the slide deck will be sent out to you, so you will have all of these resources. And feel free to reach out to us or scan the QR code on the screen. And we really appreciate your time and your interest. So have a wonderful afternoon, and thank you again.
Bye, everybody.
Bye-bye. Thank you all.